I rise very briefly, having contributed quite significantly at the debate at report stage, and I rise to support the government amendment N, which is not a position I find myself in very often. And I think I must respectfully disagree with the noble Lord Alton of Liverpool, who said this wasn't settled, as the noble lady Baroness Sugg, who's been such a leader working on this issue through the House with great tenacity and determination to defend the well-being of patients, said it has been settled in both houses in this Parliament and debated extensively. And I think, I think the point the noble Lord Alton just made, the sex-selective question, was comprehensively answered. The dates don't work. We're talking about early medical abortion. You don't know by that stage. But I think we have to come back to the evidence here. And what we had was an unintended experiment as a result of COVID. And that experiment showed us that telemedicine not only reduced the rate of abortion complication, but it also increased the level of safeguarding disclosures. And I think it's really important that we think about an equalities issue here. The access to telemedicine is actually medically preferable and results in more safeguarding disclosures. We do not want to deny that to young women where it's judged that it is medically appropriate. And I note that the National Network of Designated Healthcare Professionals for Safeguarding Children is working with the Royal College of Obstetricians and Gynaecologists to develop standards, and they say this should not be subject to a discrimination in the law. The safeguarding standards, the guidelines are adequate. And if we think about this as an access issue, this utterly minimises the risks of young people going to provision outside the healthcare system. This is a crucial equalities issue, my lords.